I'm very interested. I'm going to stay with you, Roni. I'm going to reverse the direction around the table, because of course the thing about the travel industry is you are de facto a global industry. You know, you are part of an incredibly complex, probably with food supply chain, the most complex of systems. Anybody who has even gone slightly into how global air travel works, it's mind-blowing. I mean, how many different pieces have to work smoothly without anything for everybody to move around. To what extent did you feel yourself part of a global conversation? You know, was there a, you know, we all of us have our backdoor conversations, don't we? You know, you pick up the phone and say, hi, how's it going? I need a favor, etc., etc. Was there a backdoor conversation going on across the global aviation industry about, well, how's it going? What do you think we do? Where are we going, etc., etc.? And then I'll come around, because I imagine that for all of you, that's also, those conversations have been going on to a large degree. Roni?
Well, obviously, I mentioned before that at the beginning of the event, I received several phone calls from colleagues abroad, but I think it grew in different pace, and it had, I don't know, life of its own, because even if I developed with a partner a consultation, friendly consultation, not commercial one, about how to fight either this one or how to do orthodox security while we are fighting also this thing. Because just bear in mind, try to do security to an airport filled with passengers with face masks. Now try to identify somebody that looks suspicious. All of them are looking suspicious. So all of us, when I'm looking at the mirror, I look suspicious with a mask on. But suddenly, when they were under the severe wave in their own country, everybody was shutting down. They were focusing on that, and we found even if we had good practices that we tested and we can offer as an advice, just try and test. It was hard to reach people. It wasn't not only 3 a.m., it was also 3 p.m. because everybody were focusing on defending themselves, defending their employees, obviously their passengers, and trying to dance in the rain without getting wet between ministries and regulations and government official, and it was a very unique game. I think that moving conferences into e-conferences allowed people in our sector to be more involved. They sat at home, they could have enrolled to different conferences like this one, and to get first-hand impression from people from other countries. But it's not a total replacement for the need to actually meet people, look them in the eyeball, and eventually talk. Because when we want to speak about restricted things, we cannot do it online, even with our colleagues abroad. And we have protocols to how to do so. There are things that you discuss only in a room together.
Well, yeah, of course, it comes down to discussion. I mean, Xavier, I imagine that you and the IFRC, much of what you do is by negotiation and by consent and by invitation. You know, you are guests in other people's countries and towns and cities. To what extent were you sort of having to negotiate your way around trying to do that which needed to be done? And was there any pushback from you, from anywhere, that you felt was impacting on your ability to do that?
I would say that during COVID, we faced so many demands from our network on different fronts. And I would say that the first big challenge that the institutions face is that the business model has been challenged to do new things that we were not doing in the past. And normally institutions are applying a risk-averse approach in many things, because you don't know if it's going to look good, it's going to function, it's going to have a reputational risk or challenge. And organizations like ours, what we've many times face the challenge to say, if we don't do it, what will happen, right? What we are missing, or how many people might be affected. We have different requests from governments to national societies to do things that they have never done in the past. And they come to us and to say, we need the technical support, you need the expertise. And what we function is a knowledge broker, right? In which part of the world we have the demand that is in this country right now, which expertise do we have around the global network in order to provide such an expertise? But at the same time, we have to challenge with the mindsets of people saying, no, we shouldn't do this, right? So it has been this year of constant challenges of the, some of our colleagues wrote the known unknown and unknown, which is true. And many times of those unknown, there is their risk adverse approach to do the activity. So in our system, looking to the entire globe for best practices, good practices, or bad practices, have served us to the benefit of other members of the network, but they'll also serve us to change our modus operandi in many things that we have done. For example, if I can say, we have never done a global appeal that reached practically the entire membership with domestic response plan. In the day that we say we are going to have one plan per country, become 172, people were saying that's impossible. No, if it was possible, it was given with quality, it was require us to change the business model. So for instance, we put it for first time ever a remote support system 24/7 in, I think, 8 or 10 different areas that we have never done it. So let me give you an example. We put a remote support system for emergency units that could be related to clinical or medical support, right? We were not in situ, but we were able to have experts remotely to say, this can be done, this cannot be done. This is the support being given to different national societies.
Well, I mean, and of course, the thing about it is that's different languages, different cultures, different management systems, different operating environments, different threat environments. I mean, sometimes there were external threats as well about that. Toby, on the other hand, they didn't have to deal with the British cabinet, which brings its own challenges in its own way. You are now, clearly you're not in government now, but you are very, I think you're in tune with what happens. Overarchingly, one of the issues which, of course, Xavier has talked about and is very connected to, and one of the things we spoke about on our coronavirus campfires is the fact that at the end of the day, and I think I mentioned it, and Xavier mentioned it, it has to be owned at the community level. It is, the communities don't need to be told what to do, they need to be supported. To what extent do you think there was an awareness of that? And was it implemented, was it utilized? Where are we today in terms of sort of seeing community as literally a national asset?
In the UK, there has been for decades actually a problem of central government understanding what can and should be delivered at local level. There's a distrust, there's a belief that local government either won't do it effectively or that it might do the wrong thing, whatever the wrong thing might be. And so we saw when the government pushed the go button on creating a test and trace system, the decision that this should be run nationally and centrally on a sort of command and control basis, that this thing would be set up from scratch. And what it didn't recognise were the existing local networks and existing local mechanisms that exist. And in any event, these are the sorts of things where you need a bit of local knowledge. You need to know how a local community operates. You need to know if you are making contact with an individual and they say back to you, yeah, but I was at such and such a place. You need to know what such and such a place is and how many people they're likely to be engaged in it. And that's where local knowledge comes in. By contrast, the vaccine rollout, which everyone is regarding as being much more of a success, or certainly to date, I mean, it does help if you've bought 450 million doses of vaccine, more than enough to vaccinate your population sort of 7 times over. But the reality is that is being organised by the health service at local level. And so when I get a call for my first vaccine, I was said, well, you've got a choice of 2 places you can go to have it. And my immediate reaction was, oh, I was rather hoping it was the one just down the road. And they could say immediately, well, both are just 2 bus routes from you. Now, I can't believe, with the best will in the world, a nationally organised central call centre would have been able to know what the bus routes from my home to the vaccine centre would be. But that's the advantage of local knowledge and local arrangements. So I think it's one of those things that has to be valued. Second is you have to look at what are the characteristics of local communities. In some communities, it will be the norm to provide help and support to your neighbours. People will know each other. In some of our more disconnected urban centres, people won't know their neighbours. They literally won't know who lives next door to them or in the next flat or the floor above or whatever else it might be. And that understanding and trying to look at how you can build a community cohesion, I think is going to be essential. One of the things that I'm hoping that we'll be able to do at the National Preparedness Commission is actually examine the experience of what worked well in the last year in terms of building that community response. I look around London, the city I know extremely well, and there are 32 boroughs in London. And some of those 32, you looked at the way they were responding, you thought, this is magic. They've got all sorts of innovative ideas, they're reaching out, they've set things up, all very, very, very local facilities. And there were others which were less pedestrian, they were more pedestrian about it, and basically waiting for instruction from somebody else. But what I'd like to know is what constituted the ability to be effective at local level? What constitutes a community that's ready to respond effectively? And I think there's an awful lot of experience that we should be gathering about that. But the reality is a lot of this is going to be much better organised at local level.
It's interesting because FEMA, Federal Emergency Management Agency, after Hurricane Katrina in 2005, which of course was a massive failure on every level, publicly changed their doctrine and they said it is not our responsibility to manage crises. It is our responsibility to support communities that are managing crisis, but communities manage crisis, we can't come in and fly.